This is the story of one of the most disturbing medical experiments in American history. For 40 years, hundreds of African American men were lied to, misled, and denied treatment for a deadly disease, all in the name of science. This is the Tuskegee Syphilis Study. The study began in 1932 in Macon County, Alabama, a rural area where most of the population was poor and black. At the time, Tuskegee had about 27,000 residents, and over 80% of them were African American. The U.S. Public Health Service, or PHS, launched the study. Their goal? To observe what happens when syphilis goes untreated over a long period of time. Syphilis is a sexually transmitted infection caused by bacteria. If left untreated, it can damage the brain, nerves, eyes, heart, and other organs. Back then, it was a serious public health issue. In the early 20th century, about 1 in 10 Americans had it. The study involved 600 African American men from the Tuskegee area. 399 of them had syphilis. 201 didn't. They were used as a control group. Most of these men were poor sharecroppers with little or no education. They were told they were being treated for something called bad blood, a vague term used in the South to describe anything from fatigue to anemia to syphilis. The men were promised free medical care, free meals, and even burial insurance. But they were never told they had syphilis, and they were never given real treatment, only fake medicine like vitamin pills and aspirin. There was no informed consent. The men didn't understand they were part of a medical experiment. They trusted the doctors, but they were being used. The researchers also wanted to study neurosyphilis, a form of the disease that affects the brain and nervous system. To do this, they needed to collect spinal fluid through a procedure called a lumbar puncture, also known as a spinal tap. But the doctors knew most of the men would say no if they knew the truth. So they told them it was a special treatment they could get for free. In reality, it was just another way to gather data, not to help them. The final stage of the study involved autopsies, examining the body after death. This helped researchers confirm how the disease damaged different organs. But again, the families weren't told the real reason. The Public Health Service said they would cover the costs of the funeral, but only if the family allowed the body to be autopsied. So most families agreed, not knowing that the goal was to collect scientific data, not to help or honor their loved ones. In 1943, something happened that should have ended the study. Penicillin was proven to be a cure for syphilis. By 1947, it was widely available, and treatment centers were opened across the country. But the men in the Tuskegee study were deliberately left out. There were no efforts to treat them, even as they continued to visit doctors. They weren't told that a cure existed. Some received penicillin by accident when they were treated for other conditions, but most did not. So the study became less about untreated syphilis and more about denying treatment on purpose. In the 1960s, a young social worker named Peter Buxton was hired by the Public Health Service to interview patients with sexually transmitted infections. He soon discovered the Tuskegee Study and was horrified. In 1966, he wrote a letter to the CDC, raising serious ethical concerns. But instead of taking action, they invited him to a meeting and tried to convince him the study should continue. Not giving up, Buxton decided to go public. He contacted a journalist. In 1972, the story was published in the Washington Star and then in the New York Times. The public reaction was immediate and angry. After the story broke, the Department of Health, Education, and Welfare launched an investigation. The study was finally shut down that same year, in 1972. The surviving men were given medical treatment, but for many, it was too late. Syphilis had already caused lifelong damage. Some had passed the disease to their wives and even their children. Shockingly, no one was ever punished. No doctors or scientists involved in the study were charged or disciplined. In 2010, another dark secret came to light. Researchers found out that the same group of U.S. scientists had gone to Guatemala in the 1940s and intentionally infected hundreds of people with syphilis and gonorrhea, all without their knowledge or consent. They claimed it was in the name of research to improve prevention, but it was yet another violation